Hi, my name is Sean Flynn and I'm here today to talk to you about joint movements, their axes and their planes of motion. So the shoulder joint, the glenohumeral shoulder joint. So we have horizontal abduction and horizontal adduction, and they're both in the transverse plane, the longitudinal axes, and then we have circumduction, and that is in the transverse plane, the longitudinal axis, and the sagittal plane, the medial lateral axis. And then we have the scapulothoracic shoulder joint, and we start in the shoulder shrug, so we have the shoulder shrug, and we come back up, and that's depression, and then we stay here, and we go down into the shoulder shrug, and that is elevation. And those are both in the frontal plane, and they're both anterior, posterior axes. And then we have protraction and retraction. So we have protraction, retraction. So abduction, adduction, and that is in the sagittal. They're both in the sagittal plane, and they both have medial lateral axes. And then we go down to the lumbar spine, which is right here. So we have lateral flexion and extension. So lateral flexion and extension, flexion and extension, and that excuse me, that is in the sagittal plane, the medial lateral axes. And then we have the hip and knee joints. So we have hip flexion and extension. We have hip flexion and extension, and that is in the sagittal plane, the medial lateral axis. And then we have hip external rotation and internal rotation, and that is in the transverse plane, the longitudinal axis. And then we have knee flexion, extension, and that is in the sagittal plane, the medial lateral axis. And those are the joint movements, the axes and their planes of motions for the shoulder joint, the lumbar spine, and the knee, and the hip joint and the knee joint. Thank you very much for listening, and